Hello, sir.
Hello, how are you?
I'm good. How are you?
Oh, I'm feeling a bit attacked.
You're feeling attacked? Why?
Well, today
Mm-hmm.
you're making fun of the fact that I'm follically challenged.
Mm-hmm.
Yesterday, you were talking about how much more in advance I was going to be dead than you.
Well, you're not going to live to 115. I'm sorry. Do you think you are?
If I have to be like a head in a jar like Futurama to annoy you, I'll do it.
Isn't there like a Steve Martin and what's her name?
Lily Tomlin? No,
it's not.
That's Dead Like Me.
Catherine Turner. Kathleen Turner. Isn't that the one?
Yes.
Yeah, he's got like her brain in the jar or something.
Something like that. He did some weird stuff in the 80s.
I loved it. And I just remember him at the end trying to carry her out.
Yeah.
So you're going to do that?
Be Steve Martin?
No. Be a head in a jar or something.
If I need to.
Craziness.
I figure by that point, medical science will be pretty advanced.
Both are facts. It's not teasing you or bullying you or anything. If I'm just stating factual information.
It's the inflection you put on it. Okay. If you were to say, hey, I'm probably going to live to be 115 and I don't think you'll make it that long. I'm like, yeah, you're probably right. But you always have to tack a little bit extra onto that, a little flair, and then a little, and then I'm like, okay, well, there she goes.
You did not.
Well, dome comment, you did.
Just now, you said something about top of your dome.
Yeah, and you're like, you don't have hair. That's not what I meant.
And I said, that's not how I said it. I said.
That's an accurate impression of you.
Listen,
I'm Dr. Caroline Winenko. That's exactly how you talk.
I said what?
See?
Your bald head?
This might be my favorite podcast of all time.
I am so tired.
I know, and you can't fight back.
And dizzy. Like I literally...
Because they make you swoon.
It's, 2:30 again. I've been up this morning. So it used to be, if it was before 4, I'd be like, oh, phew, thank goodness, roll over. I can wait until at least 4. Like, thank goodness, I have time to sleep. But now I'm normalizing it. Oh, well, it's 3:50, so I may as well just get up anyway. Oh, it's 3:20. Well, what am I going to? And now it's 2:30. I did try. So now I've normalized before 3 o'clock. I won't get up.
If it wasn't for you, I wouldn't know that those times existed.
I know.
Like to hear you say, I got up at 3 a.m. I'm like, that's a thing?
Well, and so this morning it was 2:30. I did stay in bed, but I stressed the whole time.
Yeah.
And that's the problem. I just stress and stress and stress. So then I'm like, well, I may as well just get up and work. But now I am exhausted and dizzy.
You're easy pickings.
Can't think straight. So
easy pickings.
And I'm not productive at all. Like all day today, I got 1 paragraph done of a grant proposal. That's essentially already written, but I'm just trying to fine tune it. Cannot.
Yeah. Well, you should power down for a little bit. Have a tea, have a read, snooze on the nesting chair.
Yeah.
Give yourself a little bit of a breather, a little bit of a break. Go frolic in the snow.
I can't believe it's snowing. That's okay. I love the snow. It was so pretty. I walked the dogs this morning and it was so lovely.
Yeah.
It's beautiful.
It's kind of funny that you get the enjoyment of the snow and I get the practical pain in the bum of the snow.
Like what?
Bus not picking up a kid, me having to take the kid to school, our recycling not getting picked up because the truck couldn't get to it because of the snow. And then some guy from the city lecturing me on where I should have put it, and me calmly. And I want to be real clear. I was a good conversation partner with this man. I did not explain to him where he could put his cellular telephone. I just simply gave my part of this, but he lectured me for 5 minutes on all the things I should have done. And I finally said, well, for the money I pay you every month, he can get out of the truck. And that's where our conversation took a turn. So I'm not sure we got our recycling picked up today.
Oh, but didn't you put it right next to the other 2?
Yeah. And he did the other 2 and not ours. Yeah. And then the guy lectured me on why mine wasn't picked up.
And why wasn't yours picked up?
It was too close to the barricade because we had road work done in our cul-de-sac. And I said, well, why did it not prevent him from the other ones? I don't know. I'm like, okay, so do you see where I'm having a trouble with this? Well, we'll try and get to it today. I'm like, no, come get it. Come get it. Right. And I know it's not the guy who called me. It's not his fault. And it's not the driver's fault. I get that. But don't lecture me. Anywho, I got 3 women in my life that lecture me. I don't need the city doing it.
Yeah. I don't lecture you. I tease you. Ooh, do the girls lecture you? We all just tease you.
You guys are mean.
Out of love. We love you.
Dude, out of love.
We love you.
Is that the equivalent of I'm hitting you for your own good? Is that the same thing?
No.
Okay.
But I do, if I offer to hit you, it's to take away your pain of whatever's bothering you else in the moment.
Worst offer ever.
But it's a true thing. Like, it's research supported.
Yeah, karate chop therapy.
Alrighty.
What are we up to today?
Well, we have another guest. You got to bring in a guest.
Dude, nobody likes me. Talk to the city guy. He's not coming on. That dude don't like me at all. That's the problem.
So we have Heather, the hygienist, coming today. She's a certified biological and registered dental hygienist for over 25 years. Did you have something you were going to say?
Is it hygienist or hygienist? And this is a legit question.
Oh, hygienist. Hygienist.
Because hygiene is the word, but I've never heard it hygienist. That's like that's like magician.
I'm going to restart. Take 2. Heather, the hygienist.
You can't say it with a question mark because then you got to read it.
Is that how you say it?
I would say hygienist.
Hygienist. Was I saying hygienist?
Yes.
Oh my gosh. See, I'm so tired.
We got to leave this all in. Like, we can't cut this out.
It doesn't sound like a real word anymore.
Okay, so I wasn't wrong to question it.
Hygienist sounds like hyena, but hygienist. I
might as well have called her Heather the hygienist.
I feel like I'm saying the wrong thing.
She's a certified biological.
You read it.
Heather the hygienist is a certified biological and registered dental hygienist for over 25 years, and author of 3 books, public speaker, dental consultant, and owner of Simply Silver Mouthwash. I've actually heard of that. She's passionate about educating people on the importance of oral care and how it relates to systemic health.
Nice.
Thanks.
Is that a word, though, hygienist? Because now I feel like it's not even a word.
You know what? I know a person that could probably clear this up for us.
Should we bring her on?
Yes.
Let's do it. Well, Heather, thank you so much for joining us on the show today. It's wonderful having you here.
Thank you so much for having me. I'm really excited.
Well, why don't we start off with you telling us a little bit about yourself?
Well, I've been a dental hygienist now for over 28 years. And I really started to get into more of the natural side of things after I had my twins. One of my twins had a lot of allergies, food allergies, skin sensitivity. So you have to really learn how to read a label. And it wasn't until about, I would say, 2010 that I started to look at the labels of oral care products. And, all of my career, you're taught to just promote fluoride, all of your commercial products. And then when you turn over the label and you really read it, and you're like, wait a minute, this is an antifreeze. This has a poison label warning. What is this doing in your mouth, which is the most vascular part of your whole body? So I just started, looking into ingredients. What are the alternatives that you can use that are effective? And that led me to creating my own oral care line. I have a toothpaste, breath spray, mouthwash, 2-pack products that are completely natural. So there's no chemicals, no poison label warning. It's all clean and green, but very effective as well. So that's kind of like what brought me to this point of time.
Wow. I would have never thought. We look at labels all the time, and, my girls will look at cereal and they'll look at the sugar count, but we never actually have thought to look at our dental care products.
Yeah, you just assume it's good.
It's really crazy because when you read the back of, say, Listerine, and then you go and you look at the SDS, which is a safety data sheet on it, and it'll say, dyes are banned in other countries, but allowed here. You've got things like saccharin, which, saccharin is a known carcinogen. And then alcohol, it's 27% alcohol, which disrupts your oral microbiome. You've got, let's see what else is in there. Oh, poloxamer 407, which I think all parents really need to look at the back of, like, even the act for kids. Poloxamer 407 is an endocrine disruptor. So that messes with your children's endocrine system, which is terrible. And the dyes alone are awful. Everything that you stick into your mouth gets absorbed into your bloodstream. So what are the long-term effects of having your children use products like fluoride that get, into your bones and can create all kinds of fluorosis, which is too much fluoride makes your bones brittle, and it can cause bone cancer. So what are these products doing in our commercial oral care products? But I can tell you the reason that they're allowed there is because all of your oral care products are labeled cosmetics. So when it's in the category of a cosmetic, it doesn't really matter. You can put a lot more junk in there than if you had to eat something. Food has all these specifications that you need to stay within. Well, oral care, cosmetics is, you can put all kinds of stuff in there. So that's why it is allowed. So you just have to be informed, as all parents who are concerned about what their children eat, drink, start looking up the ingredients in oral care products, because that really can have some long-term effects as well.
Well, what are some of those ingredients maybe that we should be looking at to avoid, and maybe alternatives too?
So everyone thinks, fluoride, fluoride, fluoride. If you don't have fluoride, you're going to have cavities. Well, lack of fluoride is not going to give you a cavity. Okay. Fluoride is in absolutely everything. You're drinking it, you're eating it unknowingly because it's in fluoridated water supply, which gets into your food, which tea bags loaded with fluoride, wine from California loaded with fluoride. You've got fluoride in everything. So if you get a cavity, it's not from lack of fluoride. Okay. It's because your saliva dropped below a 5.5. It's acidic. So when you have something that has sugar in it, say even ketchup plus sugar forms an acid. So then you have acid on top of acid, and that eats away at your enamel, making it soft and sticky. That's how you get a cavity. So you want to keep your mouth alkaline. You want to use products that are alkalining to your mouth, not acidic. Things like alcohol, the Listerine, avoid that. Things that disrupt your oral microbiome. And when I say oral microbiome, people are like, well, what does that mean? So your mouth has 700 different bacteria, both good and bad. Like your gut has, your gut biome. That's where 70% of your immune system is. Your mouth is your mini immune system. So what you put in it is going to disrupt, either the good or the bad bacteria. So what can happen is, if you're getting a lot of cavities, that acid is building up. Your oral microbiome isn't functioning right. Maybe you've got a dry mouth. And with children, a lot of times they have those enlarged tonsils, right? They're maybe breathing with their mouth open. Guess what the number one cause of cavities is? Mouth breathing, the dry mouth. So their saliva is not able to naturally coat their teeth, because that's what your saliva does. That's your natural protectant, right? So you want to make sure that if your child is breathing through their mouth at night, and as long as there's no obstruction in their nose where they wouldn't get air, you want to use mouth tape. It's like a little crisscross sticker, and keep their lips closed. They'll sleep better. They won't snore. They won't have dry mouth. They won't get cavities that way. So that is so important in making sure that they're not having airway issues. Secondly, they can use alternatives to fluoride, because the fluoride is antiquated. In my opinion, it's been around for 65 years. Are you telling me we haven't come up with something better in 65 years? Of course we have. It's called nanohydroxyapatite. NASA created it back in the 80s for their astronauts, because what they were noticing is in anti-gravity situations, their bone density was affected, their teeth were affected. And your teeth are made up of hydroxyapatite crystals. So you're giving your body, your teeth, what it's actually made out of. So that's really effective. When you think about it, fluoride, your teeth don't have fluoride in it. Okay, there's no fluoride in your teeth. Fluoride is not an essential nutrient at all. It's actually, honestly, it's a hazardous waste from the phosphate mines. So if it wasn't stuck in your water supply, it would be labeled as hazardous waste. That's very disturbing. People should really look into that. We should not have it in our water supply at all. It's a drug. There's a label poison on your toothpaste, because if your 2-year-old eats a tube of toothpaste, it could kill them. So, I think that there are definite things that you can do, like the nanohydroxyapatite, that does prevent cavities according to your scientific studies. This isn't quackery. This is actually something you can go and look at. It's been scientifically proven to be, if not just as effective, more effective in reducing cavities, filling in those little white areas on teeth, and, just in general, helping that oral microbiome so that you don't get decay. So it is a natural alternative. Coconut oil is fantastic. It's a natural antibacterial. It's, loaded with really good anti-inflammatory benefits. So there's so many things that you can do, but also, you are what you eat. So letting our children eat simple carbohydrates where their saliva is, producing all of these acids is going to create a decay situation. So good nutrition. You want to have foods that are the crunchy foods, not just the junk food. And soda is like, oh my goodness, the worst thing you could ever give your kid is soda. Because remember how we were talking about pH? Mm-hmm. So battery acid is a 1 on the pH scale. Soda is between a 2.5 and a 4. So that is way below that 5.5, right? So you're drinking acid, you're swishing with acid if you're using commercial mouthwash. So many things are so acidic. It's like an all-out attack on your enamel. And you don't regrow your enamel. You can remineralize enamel, but you don't regrow it. So you only have one coating of it. So you want to protect that for your children. You want to make sure they're eating right. They're not drinking soda. If you do have a soda, special occasions, something like that, of course, you want to have it with a meal. You want to drink it through a straw, and you want to immediately rinse your mouth out with water, because it's phosphoric acid is the number 1 ingredient, which, by the way, I don't know if people know this or not, but they etch cement with phosphoric acid, but they put it in your food because it's sweet.
Wow.
So that's disturbing.
Yeah. Yeah. Wow. There's so much to think about.
Yeah, that was a lot. In terms of trying to help kids, I guess, start off on the right foot. So as parents, we look at what we're putting into them, how to minimize any harmful effects. What are some tips for parents in terms of creating a habit of good dental health for kids?
That's really an excellent question, because, the parents are the ones that set the example. And if parents don't put an emphasis on brushing and flossing, your kids aren't either. So it all starts with leading by example. And as we were discussing previously, unfortunately, 100 million Americans do not go to the dentist every year. And dental decay is the number 1 disease in the world. So it's a disease, right? We cannot take our teeth and think that they're a separate compartment. They're in your mouth. You have one tube, starts here and it goes all the way out you. So if you've got dental decay, that's a disease. If you've got gum disease, that's a disease. It's traveling through your bloodstream. And a lot of people don't realize that we now know that you can get Alzheimer's, heart attack, strokes, diabetes, pancreatic cancer, colorectal cancer, dementia, all this stuff from the bacteria in your mouth.
Wow.
Okay? So this can cause these other diseases. And like I said, dental decay is a disease. The unfortunate thing with teeth is that it won't hurt until it's too late, right? So you'll never know that your child has a cavity or you have a cavity until that tooth hurts. Okay. By then it's too late, because enamel has no feeling. So you're not going to feel a cavity when it's in the enamel. That's when you can remineralize it. Only when it hits the nerve of the tooth. Guess what? Now you're talking about probably a $3,000 problem to fix, all because of neglect. So neglect is expensive. Prevention is not. I always tell people, don't let fear stop you from going to the dentist, right? Because, it's just going to get worse. It's going to get more expensive. So you're better off just, preventing. And I always use the analogy of our vehicles, right? We have to take our cars in for an oil change every 3 months. If we never put oil in our car, if we never gave our car an oil change, what would happen to our vehicle? Our engine would blow. How much is it to replace an engine? My father just had to replace an engine in his truck, and it was $8,000. Okay. So if you can just think about maintenance, oil changes on your mouth, so much cheaper than blowing an engine, right? Because once you start getting rampant decay, all these cavities throughout your mouth. We had a lady come in last week, and I'll just let you guess. Do you know how much her treatment plan was to restore her whole mouth?
Her whole mouth.
Yeah, her whole mouth, top and bottom teeth. Take a guess.
100,000.
Sure, 100,000. Yeah.
$70,000.
Wow.
I was going to say, in my mind,
I was
thinking 40. Yeah, but
$70,000 treatment plan because she let her mouth go so badly, and she's young. She's in her mid 30s, so she's not elderly. So she's going to have her teeth a long time, but she hated going to the dentist. She honestly, didn't prioritize that, and now she's in a situation where she's a beautiful woman, but her teeth are terrible. And again, it affects your overall health. So we want to teach our children good habits when they're young, so they don't end up in her situation.
Yeah.
So they need to be brushing their gums, not just the teeth. It's not just teeth care, it's gum care, because your bone, your jaw bone, this is your foundation. Just like a house has a foundation, your jawbone is your foundation. So your teeth are in your bone, but then your gums cover that. But bacteria forms right where your tooth and gum meet. So people are so concerned with brushing just the surface of the teeth. They don't brush the gums. You need to brush the gum line. And I have YouTube videos on how to brush, how to floss, because you need to do it properly. And brushing alone only removes 60% of the bacteria. The rest is underneath your gums. So I always tell people your teeth poop every single day. Okay. So not flossing is like wiping your butt cheeks, but not your crack. Okay. There's a toilet bowl up here in your mouth. All of that bacteria, it smells. Like, have you ever talked to somebody and you thought you could maybe just pass out because their breath was so bad?
Yeah.
Yeah. Okay. So that's active periodontal disease. Like bacteria it's so bad they need antibiotics, like it's in their bloodstream, they're sick. Okay. And it's coming out of disease, like a dead body smell. So you don't want that.
Our wedding, we're flying to Jamaica for our wedding, and the whole plane, we were just gagging. It was so terrible. It was so bad. Yes. And actually we had a hygienist on the plane with us, and she knew exactly.
Yeah, she was just like, that person needs to get help.
What it is, yeah.
Periodontal disease, it smells. Yeah. So, you don't want to let it get that far gone, because you can't regrow your foundation back. Okay. So unfortunately, so many people lose their teeth really more from gum disease, more so than cavities. I would say people tend to fall into the category of either really cavity prone or really gum disease prone. And I feel sorry for those that are both. But, especially in our kids, and I see this all the time, some mistakes parents make is putting their baby down with a bottle of formula or milk at night. It's called baby bottle rot. Okay. It'll rot their teeth because of the sugar in the milk. Remember, the sugar plus plaque forms an acid. If that acid erodes their teeth, it's rampant decay, baby bottle rot. And then, my goodness, that poor kid is going to have silver, like stainless steel teeth, or it's awful. It's thousands and thousands of dollars for your baby's teeth. And because are you going to really let them stay like that until they're 6 years old when their teeth start to fall out? Because, a lot of times parents are like, oh, well, it's just their baby teeth. Well, that can create problems for their permanent teeth. And if you don't keep that tooth in that spot, then another tooth can grow over it. And then it's just like a nightmare situation. So you want to keep the space for that tooth. So it's very important that you don't neglect their baby teeth, that you brush them twice a day. And you can get toothbrushes according to the age of your child, like on Amazon. It'll say, however many months, up to 12 months, or up to 3 and 3 to 5. So you can get toothbrushes for each stage of their life. And when they're babies, they have like the little teething rings, have bristles on them, let them chew on that. And you don't need to necessarily be using toothpaste, even if the ones for kids. Use coconut oil. It tastes great. It gets them used to putting something on their little toothbrush. It's antibacterial, antiviral, it's totally safe to swallow. So I love extra virgin coconut oil as far as a toothpaste for children. And then just getting them used to having their gums even wiped when they have no teeth, wipe down their gums with a wet rag.
Yeah.
So that way, when their teeth do start to cut through, they're not having that acid on top of it. So start keeping their gums clean from the time they're infants. And then as their teeth come in and they have different stages, you want to get them the right toothbrush. Twice a day, they need to be brushing. And then as soon as they get teeth in there, start practicing flossing. Now, I don't like the floss picks for adults. I call them cheaters because they give people a false sense of I'm flossing. All it does is transfer bacteria from one part of your mouth to the next. It does not go underneath the gum. And that's the purpose of flossing. It's not to clean in between the teeth. It's to clean underneath the gum tissue. And really the only way to do that effectively is with manual floss. And you need to use your middle fingers, not your index fingers, to wrap it properly. Again, I have a YouTube video on it. But for kids, it's fine to use the floss picks. So, you want to start just getting them used to you working in their mouth until they can get, old enough to where they do it themselves. In fact, I wrote a children's book. It's called Dorothy and the Tale of the Lost Tooth. And I created a little song in there that you can sing with your children and make it fun, but you do need to really set that example because they're going to follow your footsteps. If you're afraid of the dentist, then guess what? Your child's going to be petrified as well. So start really making an effort, make it a family event. Oh, it's time to brush our teeth. Let's sing our song, make it fun, dance, whatever, but make it a priority because you're going to set your child up for, lifetime of problems where you could so easily have prevented it, if you just taught them well and gave them good food and nutrition.
Well, we do see that our girls are scared of the dentist, but they've seen Andrew has not been as good as me going to the dentist and has had to have like root canals and things like that done, whereas I go every 6 months. And so I never have a cavity. So the girls will go every 6 months because they know, even though they hate it and are scared, because they know, what it could also look like. I'm interested. I do floss every day, but I use my pointer fingers. Why the middle fingers?
Because when you do this, you can't really get to those back teeth. When you do your middle fingers, now you can take your index fingers and your thumbs and you have way more control over the floss. And you also want to get to the very, very back side of the last tooth. Even though there's not a tooth behind it, there's still a space there. It's a pocket that you still need to clean out. So you'll be amazed at how much better you can really hug the tooth when you use your middle fingers.
Interesting.
And especially with my guys, because they have such big hands, this just makes a huge difference in really getting access to the back teeth. And also I tell people, especially the parents, maybe keep it in the shower, that way it's not out of sight, out of mind. It takes literally 1 minute and 1 second to floss your teeth. And I always tell people floss the teeth that you want to keep because like I said, your teeth, they excrete, they're organs. So that poop needs to be removed every day. That's why when you wake up in the morning, you've got morning breath. It's all that bacteria that's detoxifying. So first thing that everyone should do in the morning is brush your teeth. First thing, okay? A lot of people wait till after they eat breakfast. That's not what you want to do. You want to brush first, and you always want to wait 30 minutes after you eat before you brush your teeth. And the reason being is your saliva, it's naturally remineralizing your teeth after you eat. That's by design. So if you disrupt that process, you're actually removing the protection off of your teeth, leaving your teeth more open to decay by removing that natural saliva process. So wait 30 minutes after you eat before you brush your teeth. So hopefully people will start doing that more.
If you brush first thing in the morning and then eat breakfast, should you be brushing again, or can you wait till the end of the day?
If you've got time, great. Mouthwash is always really good for just getting rid of, any excess. And of course, I like natural products. But, if you can brush your teeth a third time, that's fantastic. But the most important time to brush is really getting that first thing in the morning. And of course, before you go to bed at night, because plaque, which is soft and sticky, it's not how hard you brush your teeth. It's the length of time that you spend brushing. So you need a full 2 minutes, which is why I like electric toothbrushes. But plaque forms into tartar, that hardened deposit, every 12 to 24 hours. So if you're somebody that produces a lot of plaque, you want to try and break up, within a 12-hour period of time, you want to get that extra brushing in there so it's not mineralizing as fast on your teeth. And children can really have a plaque problem. And I think it's more inherited than anything else. But if you can brush a third time, that's great. But at least try to rinse everything out. And just using water is even beneficial. Using water will help reduce the acids in your mouth. So that's very beneficial.
I'm learning lots because even plaque, like I'm like brushing hard, but I've got receding gum lines too. So then it's challenging. So it's good to know. I also go for length, but it's good to know you don't need to brush hard.
Yeah, how hard.
And I do think incorporating things like flossing into things you're already doing. We have our counter right in front of the toilet. So I go for my morning pee and floss. It's right there. And so I'm on the toilet flossing.
There you go.
I wipe after I floss, but it's part of my, it's just so automatic. I sit down and it's the first thing I see.
But you've made it a routine.
And that's what we have to do. Because I think that's where people kind of lose things. But do you have any?
No, this is awesome.
Yeah, really I've learned so much.
Yeah,
we think that we know everything about, oral hygiene, and there's all of this. So wonderful. There's so much jam-packed in a short period of time. Any other last minute tips that we haven't covered that you think is important, or did we cover it all?
I would just say, make sure you take your children to a pediatric dentist because they're more geared towards making children's experience a fun one and less traumatizing. Because if you take your child to sometimes a regular dentist, they can get really freaked out. So I always say, start with a pediatric dentist and let them have a really good experience there. And as they get older, you can move them over to general dentistry. But, I think it's important in the beginning to give them a good foundation.
Yeah.
I would agree wholeheartely because that's not the experience I had.
Well, I had a military dentist, so it was horrible.
Yeah.
And like put on braces, cricket. Oh yeah, I had experiences too, but I have always stayed on top. Well, that was great. Thank you so much for coming on the show. I know we've learned a lot, and I'm sure the listeners will too. Very fascinating. So I've got all of your information. I'll put that in the show notes, and I'll make sure to get your YouTube videos. I'm going to check out the flossing video for sure. Where would the best place for people to find you at?
My website, it's www.simplysilvermouthwash.com.
Okay, wonderful. Awesome. Thanks so much.
Thank you so much.